Hello, I'm Dr. Rudy Kasha. So if you're watching this video, then you are considering or possibly set up for a consultation to see me for a facelift. So we'll talk about that today, give you a bunch of information, and hopefully that will help. In the consult, I'll evaluate you specifically. I'll show you some before and afters, all of that kind of stuff. But hopefully this helps give you some information. So a facelift can involve a whole lot of stuff. So we're going to talk specifically about a facelift, and I'll briefly mention the other components that are sometimes tied into a facelift, like the eyes, the brow, that sort of thing. And then I would encourage you to, if you're considering those or having that part of the procedure, those parts of the procedure as well, I'd encourage you to go to those videos and watch those specific videos to get specific details on that. So first of all, with a facelift, awesome procedure. I kind of typically say this: the two bang for your buck procedures in plastic surgery are a facelift and a tummy tuck. So that makes it fun, obviously, for the surgeon and the patient, because we're both really happy afterwards. A facelift is super scary to undergo as a patient because it's on your face. It's very high value real estate that you can't hide, either during the recovery or, God forbid, you have something that's not perfect afterwards, because that's real life. Nothing about plastic surgery, nothing about me is perfect. So all of those things are real. So it kind of increases the intensity of that decision process and deciding if it's right for you. No one needs anything that I do. You're all perfect just the way you are. But if you're tired of some of those things that are happening with your face as you age, then this is a great procedure with very effective results, very predictable results, and if done appropriately, which is what we're going to do, very natural results. Key concept with the facelift is muscle. So everybody thinks it's skin, we got to pull on this. That's how you get a bad result, an unnatural result, and it looks like you went to a plastic surgeon. We want it to look like you never saw me. So with a facelift, we're dealing with the muscle. In the face, it's called the SMAS, S-M-A-S, and in the neck, it's called the platysma. Those are structural muscles, not movement muscles, but they're kind of like the framework of your face. And as you age, that muscle droops, and it basically drags the skin with it. And so the skin's just revealing what's happening kind of underneath. So the key component of that is fixing that muscle. That's why, me personally, from my professional opinion, there are no shortcuts. I don't do any mini facelifts. I don't do any partial facelifts, nothing like that. Because in my opinion, that looks unnatural and it's not dealing with the problem itself. And so it doesn't last and it looks like you had a facelift. So we want to deal with the actual problem, and that's how you're going to look just like you, and it's going to last for a number of years. Different age groups, typically people in their 50s, 60s, and 70s. I've even had some people younger than that, and so we kind of talk about that, pros and cons both ways. But there's definite, you can kind of think of it this way, there's a little bit of minimization or loss of return as you do age. And the reason for that is that you're losing skin integrity. You're losing collagen thickness, you're losing skin elasticity, dermal thickness, that sort of thing. And so someone in their 50s that's having a facelift is going to have a more effective facelift, a more long-lasting facelift than, say, someone in their 70s, and definitely someone in their 80s. We try to kind of push away from that a little bit, just because we want you to get a significant return from your significant investment. And as you do age, you do lose some of that. So there's a too early also, because you won't see enough return from that on that end. So those are things we would kind of assess and evaluate you specifically when we're talking that day. So with the facelift itself, the incision itself, and we'll kind of talk through this in the procedure and show you that, or the consult and show you that as well. But it's up here in the temporal hair, behind, hidden, comes down here in front of the ear, falls in this crease behind the ear, and then back up behind the ear in this way, and then back into the occipital hair, so this hair back in here. So it's a big incision, but it hides super, super well. And you'll see that in some pictures that I'll show you, how well that incision hides. It usually heals great because this face heals very well, but even, God forbid, you have a little area that doesn't heal well, it hides super, super well. Through that, we lift all of that skin all through the face and all through the neck, and then we're exposing the muscle. And we'll lift that muscle up this way in this region of the face, and then back this way in the neck, as well as repairing it down the midline, all on the inside, so you don't see any of that. That muscle is what really makes the difference. It takes those cheeks that have dropped, and it brings them back up, giving you much more cheek fullness and more of that kind of cheek line, basically, that even women are trying to create with makeup. We really define that, not in an inappropriate way or artificial way, but a very natural way. The nasolabial folds, the marionette lines that are here, it's going to clean all of that up. The jawline that's there, it's going to clean all of that up, give you a nice jaw. The neck, that's usually in a more of a C shape and kind of has some of those bands, will fix all of that. And that's that muscle repair that really changes all of that. Then that skin just gets redraped. A little tension on it, but not much, because that's not part of the repair. The repair is all in the muscle. That's how you look natural. So that resets everything in a very nice position so that you look just like you. Not right at first, we'll talk about that. But once you're healed up a little bit more, you'll look just like you and very, very natural. Key things, like we talked about the skin. When I finish with you, no matter what age you're at, everything's gonna be tight, perfectly smooth, no wrinkles at all. Some of that's because it's right away, some of that's because of initial swelling. Even if, say, you're 70 years old and you have a facelift, your neck is gonna look like you're 16 years old when we're done at first. But then, especially as someone ages in this process, so if they're getting their facelift later in life, some of those skin integrity issues that I can't control as a surgeon will show up. So little bits of crepiness, you'll see some of that come back. Little fine lines and wrinkles, you'll see some of that because the facelift doesn't change that. So those are things that we'll talk about specifically for you, that you will see a little degree of that even soon, depending on what your preoperative condition was, what your age is, what your integrity of your skin's like, all that kind of factors into that. But for most people, especially in the 50s and 60s, you're gonna get 10 plus years out of a facelift. Obviously, it doesn't freeze time. Gravity's still happening, aging's still happening. So changes are happening throughout all that time. But even for more than 10 years, you will almost certainly, especially done in the 50s or 60s, you will look better than your preoperative stance or photos, basically, for 10 or plus years. So that's a really nice thing about a facelift. It holds up quite well. But everybody is different. That's a key thing to know in a facelift. The tissue is very different, so those are things that factor in. Risks, like with every surgery, there's definitely risks, bleeding, infection, that sort of things. Key things you want to know from a facelift, we are making lots of incisions, so the risks come from that fact. So with that, you could have risks of healing problems, where you have like a little blistering or loss of skin kind of in behind the ear. Usually those are the kind of areas because they're the furthest back. That's a risk. Usually that heals up just fine and is of no consequence. You could have some numbness. Some of that's totally normal, but even larger areas could be numb, temporarily or permanent. And the important nerves are the branches of the facial nerve. There's 5 of them, and they move the face. If a branch of that nerve were to be injured, you could have a partial paralysis to a portion of your face, meaning you try to raise your eyebrows and one eyebrow doesn't go up like the other. You try to smile and your smile is crooked. The bad news is that is a risk. The good news is it's very low. It's 1% or less of a risk factor. And typically, if that were to happen, within 3 to 9 months, that nerve would usually regenerate. So everything's in your favor. The odds are for you, but it's still very important to know that. You'll get a handout and some information that has all the risks very detailed out, so make sure and read through that so that you're fully informed. But those are kind of the key concepts to know from that standpoint. Otherwise, we'll branch off for a second. You can combine a lot of other things with a facelift. So sometimes we're dealing with an upper lid blepharoplasty, that's the upper lids, lower lid blepharoplasty, dealing with the lower lids, a brow lift, there's multiple types of that. Facial fat grafting, where we take some fat from another portion of your body and we inject it into your face to get some more fullness. Those are things we can add as well. And even some laser to portions of the face. We can't do your whole face at that time because it could damage the skin flaps, but sometimes at the time of surgery we'll laser around the mouth or around the eyes and kind of tighten that skin just a little bit, improve the complexion. Or other times if someone wants to do the whole face, we'll do the facelift. 6 months later we'll come back and laser the whole face. So those are some things that you can combine with a facelift. And I would encourage you, if you're considering those, like I said, go to the other videos, watch those specific procedures. That'll give you the details on that so that you know from that standpoint. With the surgery itself, we have our own surgery centers that you'd have the surgery in, typically done under IV sedation. We have our own full staff, nurses, scrub techs that does this with me all the time. The surgery can last anywhere from 4.5 hours to 7.5 hours, depending on what you actually end up doing with that. But you handle it quite well. Because it's not full anesthesia, which sometimes it is, and sometimes people want to do that, and that's totally an option. But typically we do it under IV sedation because it's handled so well. You may remember parts of the surgery. You'll be very comfortable. You won't feel anything. It's not painful except the numbing shots. The numbing shots do hurt because they're numbing you up, and then after that you're numb. But you're conscious. You're just taking a really heavy nap. But for the most part, most people don't remember a thing, so it's tolerated really well. Then you spend some time in the recovery room. You've got a big head dressing on. Then you go home. You'll come see me the next day, and multiple visits after that. For most people, at day 3, Everything comes off, you shower, fix your hair, all that kind of stuff at home. At day 5, your first set of sutures come out. Day 10, your final sutures come out. There's very little pain. I'd say 95% of the people don't even take the pain pills that we give them. But it is tight, it's uncomfortable, it affects your sleep just because it feels weird. You look awful, so just kind of plan on just crying in the mirror if you do decide to look. You're going to lose all trust in me and think that everything I told you was a lie, so that's very normal. Because you're swollen, it looks kind of like an alien that first week or 2. So fully prepare yourself for that, because I guarantee you it's going to throw you for a loop. But that's totally normal. But most people by 2 weeks look good enough. They can go run errands, shopping, things like that, and look good enough that not many people notice. But you're really not social event ready for 4 weeks. People are on the early side of that, people are on the late side of that, so that does vary. But by 4 weeks, most people look great, and you're doing good. You're still healing, still kind of fine-tuning things, but it's not something that really other people notice at all. But great surgery. Really makes a nice difference. Something that's just super high on the patient satisfaction scale, if you want to call it that. And something that's very predictable, which is a very nice thing for a patient and for me, the surgeon. So hopefully that gives you an idea of what's involved in a facelift. You'll hear more about the other components that can be with it on the other videos. Also in some of the pre-op videos, the post-op, there's a lot of details that happen with that, so we won't rehash that in this one as well, but you'll hear along through there of some expectations post-operatively, because it is a big surgery to have, not from a physical recovery, but a little bit just from the timing and the mental side of things. So hopefully that helps with that, and if you decide to come in or you're already set up to see me for a consultation, I look forward to meeting you then.